Hi, my name's Jordan, and today I'm going to be giving a presentation on the red meat allergy. This is the case study that I mentioned. It's a 50-year-old male who presents to the emergency room with hives, facial swelling, abdominal cramping, and shortness of breath that began about 30 minutes ago. When discussing history, the patient mentions that he went to a steak dinner about 4 hours ago with his family. The patient states he has experienced similar but less severe reactions after eating red meat on 2 previous occasions but did not seek medical attention. On examination, he was found to have diffuse urticaria, mild facial edema, and wheezing on auscultation. His vital signs revealed mild tachycardia but were otherwise stable. Upon gathering more thorough history, it was revealed that the patient returned from a month-long camping trip about 2 months ago. Given the delayed onset of symptoms following red meat consumption and the history of exposure to a tick-endemic area, a potential red meat allergy, such as alpha-gal syndrome, is suspected. Supportive treatment is initiated with antihistamines and corticosteroids while ordering specific IgE testing to confirm the diagnosis. The patient is stabilized and discharged with instructions to avoid red meat and follow up with an allergist for further evaluation. Now, on to the patho. This unique disorder arises when the body produces immunoglobulin E antibodies against carbohydrate galactose alpha 1, 3-galactose. Alpha-gal is an oligosaccharide, and it exists within the cells and tissues of most non-primate mammals. This allergic reaction is unique because of the delayed anaphylaxis that occurs after consuming red meat, which typically takes about 3 to 6 hours. Now, hypersensitivity reactions involving food typically only take about 2 hours after consumption, at max. This delay is thought to be since alpha-gal is bound to lipids instead of proteins, hence, because the digestion and absorption of lipids is slower, it takes longer for the molecule to reach circulation and to have its effect. Most often, patients experiencing the red meat allergy have been able to consume protein for a long period and not had any complications or allergic reactions. And this is because the alpha-gal syndrome stems from a bite, particularly from the Lone Star tick, which then causes the new sensitization to alpha-gal. Sensitization of the patient will occur through the saliva of the tick, and then subsequent exposures to this specific carbohydrate then triggers a cascade involving the release of components such as histamine, prostaglandins, and it is evident that not all people who are exposed to a tick bite develop this, right? And it's because ticks that are engorged with human blood have a much higher amount of alpha-gal within their salivary glands. Furthermore, ticks in various areas have been discovered to have varying amounts of alpha-gal. A little bit more about the patho. So as mentioned, this sensitization occurs due to the bite of a tick, and the saliva contains proteins that are glycosylated with alpha-gal. Memory B cells expressing anti-alpha-gal B receptors then recognize the alpha-gal present on proteins. T cells then play a role in the production of immunoglobulin E to alpha-gal, and IgE then binds basophils and mast cells. When patients with this sensitivity consume red meat, the processed glycolipids coated in alpha-gal are released into the lymphatic system, and once these reach the bloodstream and the tissues, they come into the presence of basophils and mast cells, which are coated with IgE antibodies. The basophils and mast cells are then degranulated, leading to an allergic reaction. So some signs and symptoms. The main thing to look for is this delayed allergic reaction after consuming red meat, this 4 to 6 hour window. 3 to 6. And the delay is unlike any other protein allergy, which is why it can be easy to identify if you have the right situation to occur. But it's more important to note that alpha-gal exists within other products too, such as various drugs like cetuximab, propofol, things like that. These products can elicit a rapid or immediate reaction because they don't have to be digested and they're being inserted directly into the bloodstream. This sensitivity typically begins in adulthood, and the most common symptoms of the red meat allergy include pruritus, erythema, urticaria, angioedema, and anaphylaxis. Gastrointestinal symptoms can also occur like nausea, vomiting, diarrhea. And then on to diagnostic methods and evaluation. Diagnosing this requires a multifactorial approach, and it's important to gather a really thorough history, which can help us to identify important triggers, such as time spent in a tick endemic area or frequent environmental exposure, like through a hobby or their job. And this can elicit details relating to the timeline and onset of the allergy, which can provide a clearer picture for the diagnosis. A full body exam should be done to look for urticaria, rash, and a cardiopulmonary exam and pulmonary function tests should be done to assess for more systemic effects. And diagnosing the red meat allergy can be accomplished through various clinical testing, such as a skin prick test, intradermal test, and specific IgE blood test. Skin prick testing tends to be less sensitive, especially for the diagnosis of red meat allergy. Intradermal testing is more specific, but it has a higher risk of anaphylaxis. And this is typically only done when the skin prick test was negative, but we suspect that the allergy is there. Immunoglobulin E blood tests tend to be the best option because it's very sensitive and it's safer than the other two options. Now, it is said that in vitro testing can be used to identify patients who are at risk for developing an alpha-gal syndrome, but screening is not typically recommended for this disease process. Treating and managing a red meat allergy. The recommendations for this really are focused on prevention and then management at worst case scenario. For instance, this includes prioritizing patient education about their diet and medications that contain alpha-gal, but it is recommended to prescribe an epinephrine autoinjector or an EpiPen to be prepared for a severe allergic reaction or anaphylaxis. Because red meat can be avoided fairly easily, desensitization is typically not pursued. However, there are 2 case studies from Turkey that reveal this successful process, and it involves implementing a 27-step beef desensitization protocol, which includes the patient consuming drops of 0.1% cooked meat extract, and this amount is just slowly increased over a 27-day span, and in both cases, the patient experienced successful desensitization to red meat. Regarding an anaphylactic reaction, though, requiring immediate treatment, medications like H1 and H2 receptor agonist, albuterol, epinephrine, and IV isotonic solutions need to be used. Epinephrine is really important because these other medications that we're talking about, they can have benefit on specific areas of the body, but epinephrine is the one that kind of halts this process from a wider perspective of the body. And then obviously these isotonic solution is really important because we're trying to replace this fluid. And now on to patient education, which is so vital for this diagnosis. And the first thing is about medications. They need to be educated on which medications contain alpha-gal and how important it is to discuss this allergy with their doctors and especially their surgeons when they are going to undergo a procedure, because propofol contains glycerol, which could be potentially unsafe for use, and the anesthesiologist and surgeon, they need to be really aware of this allergy. Some other medications containing alpha-gal are epoprostenol, hydromorphone, acetaminophen, clofidipine, milrinone, vasopressin. Also some anticoagulants such as apixaban, enoxaparin, heparin, rivaroxaban, warfarin, aspirin, and clopidogrel. But I do just want to point out that some of the labels on these that say that they pose a potential risk, it says that because depending on the manufacturer and the individual ingredients is where this can kind of differ. And next is educating on the dietary plan. It's really important to educate these people on the causative agents of their allergy and to let them know how important it is to avoid these causative agents. And this means clarifying the types of food that can elicit this allergy, such as beef, lamb, pork, rabbit, and venison. Now onto the EpiPen. This is also very important for any allergy, that how to carry and store your EpiPen and telling them that it needs to stay on them at all times, and the location of this EpiPen, it needs to be known by the people who are spending lots of time with them. And also this EpiPen needs to be really easily accessible. It shouldn't be stored in extreme temperatures or in a car, and patients need to be regularly checking the expiration dates, but also they need to know that if this EpiPen is expired and they're having a reaction, they can use it. If they don't have anything else, they can use it. And when to use. So we need to be teaching our patients, talking to them about an action plan, and we need to make sure that they really understand this action plan. And they need to be educated on what are the symptoms of an allergic reaction or anaphylaxis so that they can use the EpiPen when needed. And patients with a history of anaphylaxis should also be educated to use their EpiPen even when mild symptoms arise, when they realize that they have consumed some red meat, due to the possibility of that symptom progression to anaphylaxis. And obviously, it's very important to understand how to use this EpiPen. So providers need to go over the specific instructions for the device that they prescribe, because each manufacturer has slightly different instructions. But in general, we need to teach our patients to inject in the upper outer thigh, and that there's no need to remove clothing unless like a buckle or a zipper or other item may hinder the injection. So, follow up. In the emergency room or urgent care setting, patients should be educated to return if they begin to experience recurring symptoms. But most of the time in these settings, patients have already been observed for 4 to 6 hours to ensure resolution of this reaction. But these providers really need to educate patients to go and discuss this with their primary care provider so that they can identify this as a potential allergy if that wasn't done in the ER, and identify other allergens, and then formulate that action plan. And then managing that allergy is an ongoing discussion with the provider and maybe a preferred specialist. And now on to the referral. Patients may really benefit from a referral to an allergist, especially if the patient has an allergy that's moderate or severe or induces anaphylaxis. Risk of patients and society on noncompliance. Obviously, there is a huge risk to noncompliant patients, to themselves. If they're not compliant to these dietary restrictions and monitoring the medications they're taking and talking to their surgeons and all these other protective measures, then they could have another reaction and it could lead to anaphylaxis or death. Now, from a society perspective, there really is no risk to society if individual patients don't comply with the avoidance of these items. But I do just want to point out, when it comes to family and friends and coworkers and things like that, for those that are in close proximity to these patients on a regular basis, witnessing an allergic reaction and then being tasked to intervene can be really scary. And so non-compliance by the patient can lead to a really frightening situation for these people. Role of the advanced nurse practice nurse and the DNP is patient education. And we've already gone over this, but this is about the triggers and avoiding cross-contamination and the importance of avoiding these triggers. And it also means creating an action plan with them and how to recognize if they're having a reaction and what to do if those symptoms arise and how to use their EpiPen. And this is a really big aspect of this disease process, or this allergy, excuse me. Next is care coordination. DNPs are responsible for ensuring continuity of care and collaborative efforts to ensure the best possible care for patients is being given. And this involves making referrals to an allergist and then collaborating with them to confirm test results and prescriptions, and just in general being on the same page so that nothing falls through the cracks. But managing acute reactions is really important. And depending on where you practice, this may be more or less likely, but we have to be prepared for situations where patients have anaphylaxis or really severe allergic reactions, and we have to be educated on the immediate treatment recommendations and transferring their care and things like that. And the last is just ongoing care and support. Especially in the primary care setting, we have to be monitoring for changes in these symptom presentations and for the development of new allergies and new sensitivities. And helping to promote mental and emotional health is really important because these allergies can induce a lot of anxiety in people and sometimes can alter quality of life. However, with meat allergy, that is slightly less likely. Now, from the Christian worldview, depending on the setting, a DNP may be able to offer encouragement to patients with scripture and prayer, sharing verses like Matthew 6:34 and Matthew 6:27 and Philippians 4:6-7 can really aid in providing a more holistic approach to patient care. And Matthew 6:34 says, "Therefore do not be anxious about tomorrow, for tomorrow will be anxious for itself. Sufficient for the day is its own trouble." Matthew 6:27 says, "And which of you being anxious can add a single hour to his lifespan?" Philippians 4:6-7 says, "Do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God, and the peace of God, which surpasses all understanding." And similarly, praying with our patients when they come to you and are like, "I'm afraid and I'm anxious about this new allergy and the risk of having another reaction," is a great way to walk alongside them. But the reality is this just may not be appropriate for most care settings. And in such settings, it's really important to have empathy and compassion for these patients. And this heart posture will enable the DNP to utilize therapeutic listening and better provide clarity. And this, in turn, can reduce that patient fear and anxiety. They just want to feel seen and heard. And these are my references. So thank you guys so much.